Hello, everyone, and welcome to COVID-19, the Nexus of Health, Race, and Class. My name is Paula Edgar, and I'm a partner with Inclusion Strategy Solutions, LLC, and I'm happy to be your moderator today. Before we get started with the panel and the panelists, I'd like to acknowledge our sponsors. We're going to start with our first sponsor, who is Walmart. Our second sponsor is ShotSpotter SST Inc.
Good afternoon, and thank you, Noble, for allowing ShotSpotter to co-sponsor this very important discussion. Indeed, there's a social disease that's taking too many American lives and devastating those families left behind. The survivors of this disease may face a lifetime of medical complications from their exposure. The economic implications are hard to comprehend as well. This disease has placed a tremendous burden on our healthcare system. And we've learned that a person is more vulnerable the closer the social contact with someone who's been afflicted or is actively afflicting others. Social distance determines victimization. Unfortunately, we've seen our response to this disease dividing our country across partisan lines. Too many Americans are unwilling to make a small sacrifice in their personal liberties, instead affirming their rights and privileges at the expense of others. We see our neighbors suffering needlessly as our national leaders have failed to provide a meaningful strategy or the necessary resources. The federal agency assigned to this threat has been understaffed and underfunded. We have learned that this disease is also causing significantly greater harm on persons of color, giving rise to our suspicions that the failure of some elected officials to address it may be further evidence of systemic racism, that their indifference is deliberate. We've also come to realize that Americans are resistant to widespread lockdowns, that restraint on the liberty of folks has a social cost and incurs resentment. Rather than regulate the masses, we need data to identify the limited few who should be quarantined. I'm not talking about COVID-19. I'll leave that to the panel. I'm talking about gun violence, but the similarities are striking. We need to better protect our communities from both of these diseases. For now, science and data are the best tools to navigate our way. ShotSpotter stands ready to assist you on this journey. Thank you.
Thank you so much. And our final sponsor is the Partnership for Safe Medicines, PSM.
Hello, my name is Sven Bergman, and I am the Senior Advisor for Anti-Illicit Trade Strategies for the Partnership for Safe Medicines, or PSM. We are so grateful to be sponsoring Noble and your 2020 Virtual Annual Training Conference. PSM is a public health group committed to the protection of consumers against counterfeit, substandard, and unsafe prescription drugs. Our members include pharmacy associations, industry, public health, and law enforcement groups. To further our mission, PSM has partnered with law enforcement experts and associations across the country to educate leaders, policymakers, and communities on the dangers of counterfeit medicines. We are honored to have Noble as a partner in this mission. The illegal manufacturing, trafficking, and sale of counterfeit medicines and medical supplies is a criminal enterprise worth hundreds of billions of dollars annually. Over the years, we have seen a wide array of fake drugs across all 50 states, including counterfeit versions of insulin, flu medicines, cardiovascular drugs, and even cancer treatments. In 2015, counterfeit drugs turned even more deadly with the arrival of fentanyl-laced counterfeit prescription opioids. Now, criminals are taking advantage of the COVID-19 pandemic. CBP has already seized over 1 million counterfeit PPE face masks, fake medicines, and counterfeit test kits. The Department of Justice is reporting a steady stream of investigations, and several agencies have issued warnings about COVID-19 fakes and scams. Crimes of counterfeit medicines and medical supplies are often committed online by criminal actors pretending to be safe and legitimate businesses, such as Canadian pharmacies or medical supply distributors. PSM has been tracking the spread of COVID-19 scams and frauds, and we will be working with Noble to provide educational tools and resources on how to avoid counterfeit medicines and medical supplies to Noble members and to communities you serve. Again, on behalf of PSM, we are immensely grateful to be supporting and partnering with Noble. We look forward to the continued partnership. We wish you all a very successful conference.
Thank you again to our sponsors. Without you, this would not be possible. And so I want to just remind everyone what the charge of our panel is before I bring in our panelists. We're going to be talking about COVID-19 and the nexus of health, race, and class. And to the points that we have discussed in just the openings in terms of what the sponsors have said, we know we're still in quarantine. We, as African Americans and Blacks, have been detrimentally affected by this disease. And then there's the additional diseases that we are dealing with in terms of systemic racism. And there's a nexus of this in terms of health, race, and class. And so we have a wonderful panel today who will be talking to you and answering some of the questions that I have about this topic. We do hope that you will also add your questions in, and we'll be able to accommodate them as they come in, but probably mostly at the end. And so I'm going to introduce our panelists and let you know there have been a couple of shifts in terms of who will be on our panel. So we are going to begin with Dr. Patrice Harris, who's the immediate past president of the American Medical Association. Hi, Dr. Harris.
Hi, hello.
Hi. We also have Dwayne Crawford, who is the executive director of Noble. Hi,
hello.
Dwayne. Hi.
Nice to meet you by video. Hello, everyone.
Good to see you as well. And then we also be joined by James Craig, Chief of Police of the Detroit Police Department, who will be joining us shortly. I'm going to ask each of you, the panelists who we have on screen already, to introduce yourselves and give us a little bit of background. And we are going to start with Dr. Harris.
Well, again, good afternoon, and thank you so much for inviting me to participate on this panel today. I am Dr. Patrice Harris. I am currently the immediate past president of the American Medical Association. My term just ended about a month ago. I was the 174th president of the American Medical Association and the first African American woman to be the president of the association. The AMA is the largest organization dedicated to being the ally of physicians throughout their career, but also the ally of our patients. And certainly at the AMA, we are engaged and committed to center equity in all of our work. We just established, actually about a year ago, our Center for Health Equity. It's our first Center for Health Equity, and hired our first Chief Health Equity Officer. And so we plan to embed into the DNA of our organization and our work issues around equity. And so what an important conversation that you and we are having today on this panel. And what we will have to do, though, is commit to continued conversations about race and health and equity. This is just the beginning, but thank you for the opportunity to be with you today.
Thank you for joining us. It is a pleasure to be moderating a panel with someone who is a trailblazer and an expert in her field. And so, Dwayne, we're going to kick it to you next to provide us a little bit of context about you and what you do, please.
Definitely. Well, it's a pleasure to be able to address our Noble audience and our Noble family. We thank everyone so much for being part of our virtual conference this year. As many of you may remember, under the leadership of our national president, Sherlyn J. Davis, as well as our executive board and many of our committee chairs were involved in this decision, we launched the CARES initiative. And the goal there was how Noble was going to respond to the pandemic, to the COVID-19 pandemic. And we were so excited that our members and our chapters and our regions got on board. We focused so much on making sure that we provide technical assistance and advice and counsel to our law enforcement community, but also to the broader country and nation. We also were very effective, I think, in making sure we dealt with some key concerns that we had. Number one was how can Noble, how can the law enforcement community support those that were sheltering in? And we focused so much on making sure that we got safety tips and recommendations to those, whether it be our senior citizens, whether it be those that be dealing with domestic violence, or even our young people. We really focused so much on making sure we could get PSAs and information out to those communities. But then secondly, we really relied on our police chiefs, our sheriffs, our federal officials, and really being able to talk about how they were addressing the pandemic as they provided service to our nation and how they were able to protect and serve our communities. And so we did a number of town halls in that area. And then thirdly, we also wanted to talk so much about the need of faith, and working with our faith-based community through our national chaplain Bledsoe and others, and hosting our blessing of the badges, and really trying to use prayer and faith and how we cope with the COVID-19 pandemic. And last, I'll say this, and we're still working on this area. We know areas like PPE and things of this sort of other resources are going to be required as we support our first responders and our nation. And we also know, unfortunately, we'll be coming on part of the flu season, and we're very concerned with how that's going to ravage us both from a COVID-19 standpoint and our normal flu season. So again, we have a lot of work ahead of us, but thank you for this moment to talk.
Thank you. And as we know, given the quality of the panelists that we have set for us and the nature of the work that you all do, that there may be some people who have issues in terms of being here on time. So please be flexible with us as an audience. We will accommodate Chief Craig once he is able to join us, and I'll have him introduce himself then. But we're going to go ahead and jump into the questions. And I'll just give you a little context about my experience. So I'm an attorney, and I'm also a diversity, equity, and inclusion consultant. And so the work that I do is centered around equity and this nexus of the different pieces of who we are and how we bring together communities in order to counter barriers and counter obstacles, and to put in strategies in order to make sure that we as a community are prioritized, and that we are not further traumatized by the different things that are happening now. And so my first question is for you, Dr. Harris, and it's this. History shows that severe illness and death rates tend to be much higher for people of color during public health emergencies than for our white counterparts. What do you think are the root causes of these outcomes?
Well, that's a very important place to start, and we can start right here with our current public health epidemic. And we see that Black and Brown communities are disproportionately impacted. Of course, it's variable across the country, and we always have to respect the local data so that we can be clear about targeted interventions. But overall, as we've seen, Black and Brown communities have a disproportionate number of infections, and clearly, and unfortunately, have been disproportionately impacted when it comes to the worst outcomes for COVID and COVIDly, and tragically, death. And of course, as with any other public health crisis, there are many reasons. Certainly, as we've known, you get worse outcomes from COVID if you already had a pre-existing condition, diabetes, high blood pressure, if you're immunocompromised. And so we came in, Black and Brown communities came into this COVID-19 being disproportionately impacted: hypertension, cardiovascular disease, diabetes, really a number of health issues. But when we talk about COVID, those certainly were factors in worse outcomes. And then you look at essential workers, those who did not have the privilege of staying at home, right? And who had to continue to work. Therefore, they were more exposed. And that is another issue. And certainly, if you look, certainly in multi-generational families, living in multi-generational family households, certainly living in denser areas, and we really can then go back and pull a through line from those risk factors to, let's just say, 401 years of injustice, policy, norms, practices, laws, regulations, again, that have impacted Black and Brown communities. So it's all of these factors. And then, if you look at talking about the trauma and the stress of racism and a concept called weathering, where it's sort of this chronic insults, day-to-day insults also, which have a negative impact on health. So for all of these reasons, we've seen the numbers and the data are clear. Black and Brown and our Native American communities have been negatively impacted.
Thank you so much for that context. Dwayne, did you want to add something to
Yes, I would
that?
echo what Dr. Harris has said. There was a study done, and I'm sure she's probably familiar with it more than even I am. I want to say a little bit over a decade ago, there was a study done called Unnatural Causes. Unnatural Causes. And in a prior life, I was part of that project. But it talked about how just your skin color alone was the determinant that you would live a smaller life, or you'd have a shorter lifespan than our white counterparts. And as you said earlier, Dr. Harris, it's playing out now. You look at everything from our inability for many people of color to shelter in because of the kind of jobs they have, or the inability to be able to social distance, or even just in many cases, our pre-existing conditions. But I would also say this, with any pandemic, those that are empowered with the responsibility of being the leader of medical efforts also knew this. And the ability for our government to be proactive to say, we know we have vulnerable communities out there. So I also think we can also lend our voices by holding people accountable to say that it's important that all citizens are receiving the proper care. And keep this in mind, we're still in the midst of this pandemic, and we've got to encourage all of our citizens, including our Black and brown communities, to social distance, wash your hands, wear the mask, do our best to stay healthy. But I'd also say must keep pressure on a medical establishment to provide whatever resources they can in helping our vulnerable communities.
Thank you for that additional context. There's a question that's come in that I'm going to get to in just a second. But one thing that I thought of when both of you were giving your comments was, we're talking about the sort of effects of pre-existing issues in terms of our health. We're also thinking about the effects of systemic racism and how that has affected Black and brown, people. And that looks like access to education, right? That looks like access to healthcare. That is, a more of a proponent to be involved in justice involved, right? So there's all of those different things that are at this nexus as well. And I think leads well into this question that's come into the chat that I'll read to you, which is, during the onset of COVID-19, when hospitals were overwhelmed and resources, especially ventilators, were scarce, could bias related to race or socioeconomic status play a part? Could bias related to race or socioeconomic status have played a part in who lived or died? And I'm guessing they were probably wanting you to respond to that, Dr. Harris.
Yes, and let me just say, that was not that in and of itself as regards bias, but I'll get to that. But we were trying to avoid being in the situation where there were scarce resources like ventilators and the like, where decisions had to be made regarding who received the resources and who did not. So that was the reason. And from the very beginning, we encourage everyone to shelter in place. And I will tell you that, of course, that not just having the need to make those decisions in and of itself was a problem. The AMA has thought about this, and many institutions thought about this beforehand. We even have ethical guidance regarding how to deal with scarce resources. And one of the recommendations that come from our ethical guidance is to make sure that big institutions, hospitals, everyone has policies in place before we get to a crisis situation, so that in that crisis situation, you won't even have the appearance of making those decisions based on bias. So that is certainly critical, something we always have to think about and make sure. But we will definitely have to keep that top of mind, because as we know, we all have people use the term either unconscious biases or implicit biases. So I think we would be disingenuous if we said and pretended that we didn't. And that's everyone, that's all of us. That's why, again, it's so important to have these policies and procedures beforehand. But it's also, and this gets back to a bigger issue, it's important to have the people who are making and developing those policies and procedures be a diverse group. And again, that lends itself to anything. So as hospitals and institutions were developing, and many had those, I mean, this was not something new, developing those, the question should be asked, who was in the room when those policies and procedures were developed? About what to do with scarce resources, but about all other aspects of care to the community. And so as we, again, get on the other side of this epidemic, we are going to have to talk about, accountability, just what you said, and make sure that people in decision-making positions represent the communities that they serve.
Absolutely. I'll just add that this conversation is, again, it's almost the perfect storm in the worst way. So the historical inability for many people of color to get the kind of opportunity, whether it be education, jobs, housing, but you're seeing it play out. Unfortunately, even you look at the area of benefits, just our ability to kind of have the health care that does keeps us from having the amount of pre-existing conditions. So sadly enough, it's all the historical injustices and inability and lack of fairness and equity, but sadly it's on the backs of people of color that is playing out. And I agree with Dr. Harris. We'll hopefully get past this pandemic at some point and have some real tough discussions about how the historical decisions in our country and in our world in some cases have played out to really be at a deficit for people of color.
Certainly. And I think particularly troubling is the sort of political decisions that were made and how that affected decisions that were made at the local, state, and federal level that had pretty much across the board for those three areas, detrimental effect on Black and Brown communities. I just think about the decisions that were made from public entities versus private entities and how there was some ability for there to be, agency there, where to your point, Dr. Harris, if there had been policies that were set and people were held accountable to, that agency would have been narrowed and the ability for bias to be infused into those things would have been lessened and people would have had a more equitable chance for receiving the support that they needed. Okay, so I'm going to move on to another question, and I'm going to go out of order because I want to hopefully have the chief join us and be able to ask him that next question. But our next question I'm going to have you lead, Dwayne, is this. The COVID-19 pandemic presents one of the most unique challenges ever encountered by law enforcement. The implications of how we respond to this crisis will have profound effects on social norms. What are some of the strategies that I would say officers and law enforcement leadership can engage in to cope and mitigate the impact of stressors resulting from this pandemic?
Yeah, and as many of you all know, I've not had the pleasure of being a chief or a sworn officer, but what I will do is share with you a lot of the feedback we received from our subject matter experts in this area. And the first thing was really on the front line and really the ability of the training and being a proactive nature of how we're going to be able to do manage our actual workforce, our manpower, and hearing all the things from the field that you have done to do that, meaning your shifts, having more people working from home, the ability to be able to do have the PPE in place, but also having basic things, sanitizer, how you're able to do sanitize your equipment, your vehicles, your offices. Also, as a very interesting conversation I was in New Jersey, where they talked about how many within the law enforcement community were able to educate and inform our medical first responders, meaning many of you in law enforcement are able to deal with crises on a daily basis. And I thought it was very interesting as you talked about the leadership that law enforcement is doing in helping our medical first responders in the midst of a pandemic of how do you manage through that. And the last thing I'll say, and I know Chief Craig will be joining us pretty soon, he gives an amazing testimony about what he needed to do both mentally, physically, and emotionally and spiritually as he looked to come back. But I think the leadership of our members and working in all aspects, and I think also listening from the field, listening to your actual workforce of what do they need. For example, we at Noble began doing surveys and requesting information from all of our agencies across the country on what your needs were. Well, the biggest needs that came back were gloves, hand sanitizer, of course, other kinds of PPE. But the biggest one were fairly basic thing. I say basic, gloves, PPE, and I should also say the mask. Those masks were also critical. Those are probably the three biggest areas we got, and we're still working right now and sourcing those for our law enforcement personnel. And lastly, I'll say back to the area of just mental health. I think ways that you all in the law enforcement community have worked to kind of keep a very positive environment, really trying to keep people upbeat, knowing that they're walking every day in some cases in a very dangerous environment, not just in their regular job they would deal with in a normal space, a normal world, but now with the COVID-19 pandemic and how you navigate that. But again, we applaud our men and women that serve as law enforcement and those in our broader first responder ranks.
And if I could quickly add, because the audience may know, but I am a psychiatrist by training here in Atlanta. And I'm just always glad to hear anyone even mention the term mental health. It's something that we don't talk enough about. And certainly throughout the course of this pandemic, of those on the front line in your profession in the law enforcement profession, again, who didn't have the privilege, your work actually is not work from home. It's important to have systems and supports in place to support mental health, both in your personal life as everyone is navigating this new normal or this new situation, but also in the work that you do. I know many systems set up opportunities for physicians and nurses, those in hospitals, to get the support that they need, because this has been a very stressful time. And so hopefully folks are willing to talk about that. You know, I know it's tough. I was just telling you, as physicians, you know, we are always helping others, and sometimes we forget to help ourselves. So mental health is important. And I'll just say one thing, it's not really the focus of the panel today, but just earlier today, I was on a panel. I also chair the AMA's opioid task force. And we really were talking about the intersection of law enforcement and dealing with overdoses and all of that. And clearly, there are some issues around the legal system, but hopefully we are getting to the point where everyone realizes that if mental illnesses and substance use disorders are brain disorders, they're chronic illnesses, just like diabetes and hypertension. And I just want to let the law enforcement community know that we are ready, willing, and able to have conversations about that, so that we can make sure we are moving away from incarcerating those who have a substance use disorder and getting those folks to treatment.
So I definitely, in hearing what you just said, I'm thinking about some of the mental health challenges that exist in terms of being a first responder as a law enforcement, person in law enforcement, and then having to deal with also being a part of the communities that are being affected at this time, in addition to the sort of public discourse that's happening that is challenging in terms of being a member of law enforcement and understanding that there is a social justice wave that's occurring at the same time. And so when thinking about the mental health aspect of that intersection, that is multi-levels of challenges that exist in that space, in addition to doing the work that has to be done, right? And so thank you for highlighting that, Dr. Harris, and that need to be focused on our different cohorts and the different things that they're experiencing, because without mental health as a part of both our self-care and as well as considering the people in whom we may have to interact with for justice work, we won't be doing this right. And I think that when in terms of equity being advanced, we definitely have to have that conversation. Dwayne, did you want to add anything else at this time to that?
No, I'll close, but I'll say that Dr. Harris ditto. We've gotten, and we had actually an earlier session today about the area of mental health. But yes, I think that is kind of probably the most critical part. That's kind of the unseen part of this. So you can identify PPE needs and things of that sort. But we're very much concerned, and many of our chiefs and sheriffs and federal officials have said what you've said, that they're so concerned about the mental health part. They may not even find out until maybe well after this pandemic ends. But yes, that is a very serious, just as important as anything else in combating COVID-19.
So it's not lost on me that some of the questions that are coming in through the chat, as well as some of the questions that I had posed, were probably going to be pointed by the chief, and he has not been able to join us yet. And so I'm not sure in terms of context how you want to go forward, Dwayne, in terms of asking some of the questions that are specific to some of the strategies that police departments are managing at this time in regards to keeping their officers safe. Are you wanting to respond to those, or should we try to hold off?
We can definitely provide, after this discussion closed, we can definitely provide. There was a previous town hall we hosted just on COVID-19, and it had both police chiefs, sheriffs, but also FEMA on that line. What we could probably do is provide that video to our listening audience, and it really gave us some really good tactical things that people can be deploying during this pandemic.
Perfect. I would also say here too, because some of the contents that are coming in, I know there are people who are listening at this time who might be able to provide some feedback in terms of what their different offices are doing in response
Absolutely.
to managing and trying to keep their offices virus free. And the question that's in the comments, there's another question that I had that we might be able to talk about in terms of Dr. Harris may be providing point on, which is some of the strategies that might be being employed right now in terms of jails and prisons and detention centers,
Yep.
and some of the strategies they might be utilizing in order to help keep their population virus free.
Yeah.
So I don't know if you wanted to add anything in terms of your thoughts about what maybe best practices would be, if you don't know
Well,
specifically as to what's happening.
Let me just add this real quickly. There's some great information out there on the CDC website. They've actually taken a number of different occupations and provided an amazing amount of resources in detail, including in law enforcement. So we can also, I think, and we'll do that actually by our email systems here, both Excel events and our constant contact email. We'll send it out, but there's amazing information available for the occupation of law enforcement through CDC that really gets into a lot of detail of actual applications, technical kinds of things to consider, and we'll make that information available.
Wonderful. Dr. Harris?
Yes, and clearly, there are high-risk environments, no question. And when you are incarcerated, you are in a high-risk involvement, and you don't even have an opportunity to social distance and some of the things that we know work, because at this point, as everyone hopefully knows, we don't have a treatment. There are a couple of treatments that have been promising, remdesivir, looking at a steroid, dexamethasone, and of course we are working on a vaccine. But we just have to make sure that the nursing home population, we've seen a lot of outbreaks in jails and prisons, and we've seen outbreaks in meatpacking plants, where folks are doing work and they're in close proximity, and the work just calls for the work, or the situation really does not allow best public health practices. And so I know there have been some guidance, as Dwayne said, on the CDC, but I think the thing we want to make sure we remember is testing. And let me just say, we see it every day. That there are hours-long lines for testing, that people are waiting, 7, 10, 14 days for the results. So there's no question that we are not where we need to be regards testing. And that means testing in the community or testing in high-risk populations. So again, early on, the American Medical Association called on the administration to invoke the Defense Production Act and really activate that for all the supplies that we will need. Of course, in the very beginning, ventilators, PPE. Now, in certain circumstances, ventilators are not at the top, but we still don't have the PPE that we need. And if people are in these high-risk situations, they need PPE. And of course, going forward, as we want to plan for school reopening, we need PPE. Personal protective equipment, the gloves, as Dwayne said. We also need the test. And sometimes people think the test, and you have the test and the swab and that's it. But again, those tests have to be analyzed, and it's complicated. And I don't pretend to be a lab expert, but I know there are chemicals that are needed and the machines that are needed. And so it's very complicated, but clearly we are not where we need to be in the country. And so in order to keep everyone safe, particularly those in high-risk settings, we really need to hold people accountable for testing.
Absolutely. And I want to thank the folks who are in the comments providing the feedback that I asked for. So Jen Hollingsworth Reed shares that Portland Police Bureau has provided masks and requires wearing masks if in a vehicle with another person, as well as wearing any time when moving within a building or within 6 feet of another inside and out. And thankfully, the Portland Police Bureau has only had 2 confirmed cases so far out of roughly 1,200 members. So clearly some of the feedback or some of the guidance that's being given is working. And then I'm hoping I'm pronouncing this right. Lavani Bickerstaff has shared that the PBP conducts wellness checks daily for each officer, practices contact tracing, and has placed travel bans on the police department along with following CDC guidelines to wear masks. So again, obviously some of the best practices are being implemented. And I'll just say, clearly this is not across the board, because just in terms of my layperson view of seeing some of the protests that have happened here, I'm here from Brooklyn, New York. I have seen inconsistency in terms of officers wearing masks and other PPE in interaction with the public, right? And so that also has a challenge in terms of first responders staying safe, as well as in those interactions as well. And so, without a doubt, and of course, wanting to hear more feedback and questions from the attendees, having some consistency and following some of the basic things is important in terms of making sure that first responders stay safe. And then to the point of Dr. Harris is staying on our leadership in terms of making sure that people are going to be providing the feedback needed, the resources needed to keep everybody safe, including our first responders, because we do know that in terms of those interactions, they are on the front line. And so if we're not prioritizing and making sure that they're getting consistent support, then we're going to have a challenge multifold. To your point about schools opening and all these other things that are looking to happen, it won't work unless we have consistency in terms of people protecting themselves and the public they interact with. Okay. So I think we've actually answered a few questions within our dialogue. But here's one that I want to also, again, ask for you to manage, Dr. Harris, is what are some strategies employed to address health disparities with people of color as it relates to COVID-19? And I know we've touched on some of this, but in terms of anything else that you may want to add at this time in response to that question.
Yes, specifically because certainly we know there are longer term strategies, and I probably will mention a couple of those that we're working on the AMA, but specifically around COVID, we really need to, first of all, collect the data. We saw some data early on coming out of DC, coming out of Chicago, coming out of Milwaukee and New Orleans. But certainly there was not a routine, a collection of data regarding race and ethnicity, really gender, all of those demographics. And that's, again, why early on the AMA called on CDC and HHS to begin to collect that data. And of course, not only collect the data, but to disseminate that data. Another key component of data collection is zip codes. I think everyone is aware that unfortunately today, because of health inequities, your zip code certainly can determine your life expectancy. And so, we needed to make sure that if we had the testing available, and again, it all gets back to testing, but from what we knew, if we had the zip code data, the race and ethnicity data, and we saw outbreaks or we saw an increase in infections and positive tests, we could then target interventions to that. So right now, I think in this COVID pandemic, we need to do a couple of things. We need to make sure that we get the data so that we can, and quickly, so that we can then target interventions. We need to make sure that everyone has accurate information. There's so much misinformation and disinformation out there, particularly in Black and Brown communities. I said at the very beginning of this pandemic, I spent the first couple of weeks not as president of the AMA, but just as a family member and friend, because a lot of friends and family and others who knew me personally were calling or texting to say, we're okay, right? As Black people, we're okay. We aren't susceptible to COVID-19. So there's so much misinformation and disinformation. So I encourage everyone to make sure you're getting your information from a reputable source. Not everyone. Some people receive their medical degrees from Facebook. I would say if anyone received their medical degree from social media, I would not consider them a credible source of information. And that's what we've tried to do at the AMA, is make sure that we put out the information and based on science. And I will say one more thing, because I know it's frustrating, but a true scientist, a true person who follows the evidence will tell you what they know. They will also be upfront and honest about what we don't know. because we don't want to overpromise and make promises and make definitive statements. Remember, and I'll just remind everyone, this is a new coronavirus. The family of coronavirus is not new, but this particular one is new. And so we are learning a lot of information because this is a brand new virus. So I think it's about the data, making sure you get accurate information and making sure you wear a mask. It should not be, unfortunately, it has turned into a partisan issue. But put that aside, we cannot control it. Mask wearing is not partisan. As Dwayne said earlier, wear your masks, stay 6 feet apart. If you can, of course, except for your immediate family members. Certainly we want you to go outside. That's okay. But you shouldn't be indoors. It shouldn't be around crowds. I mean, just not safe. And so those are the things that people can do right now. And hand washing, of course. Those are things that people can do right now. And then the longer term, we do have to have those conversations about policies and practices. And the AMA has a campaign about Black women and hypertension. So there's a lot of work going on. But right now, in the midst of this pandemic, those are the few of suggestions that I can make.
Those are wonderful suggestions and ones with strategy and thoughtfulness and data, which we are, to underscore your point, we need. Dwayne, before I get to any response you have there, I want to just share some additional feedback coming into the chat. So other things that are being done to keep the community and police officers safe at the Pittsburgh Bureau of Police has been enhancing their telephone reporting units, so lessening some of that interaction, providing masks to the community along with educating the community. And in addition, some of the outreach in Pittsburgh has included outreach workers to assist with community food drives, checking on the well-being of the isolated and vulnerable citizens to assist with needed resources. So those are all wonderful things that can allow for community interaction without maybe some of the more problematic interactions that might be more challenging in terms of interaction. So Dwayne, go ahead, whatever you'd like to add.
I just want to add, and I know that Harris mentioned a couple of times, we need to take this testing, I think, very, very serious. You know, our population in the United States is roughly about 4% of the world population. And we're approximately 25% approximately of the worldwide numbers of deaths and also worldwide numbers of those that have been infected by the COVID-19 virus. And that's just unacceptable results. And I think this testing, Dr. Harris is right. It is no excuse that we do not have a national testing plan. How about this? Forget the testing. We don't even have a plan nationally. Let's get to that part. But the testing is critical. We can't do the testing in volume and get results less than a week. It's almost impossible to do the tracing and things on the back end because it's taking people multiple weeks to get their results. And not that I'm trying to get you all to go and spread. It's not even about politics. Just what you can do locally to talk to your local politicians, your senators, and your congressmen for your states. We've got to keep the pressure on that we must get to the testing, but even broader, what is our plan B as a country? And it's not about, this is about lives. This is about people losing their lives. And let's be very frank, you have many, many countries that have not stopped the virus, but have had some success in controlling or at least bringing down the peaks that we're having right now here in our country. So I would encourage all of our listening audience that we definitely should be focused on the areas around Mr. Floyd and all the protesting and issues around justice and equity, absolutely. But I would also see need to be just as vigilant in holding our government accountable and encouraging them to have a national strategy and not just allow the states, and they're just doing the best they can, but put the onus on the states to solve this. It's going to take a national plan. I'll be very frank with you, it may require us to go back into a sheltering environment, but I am very concerned that without the testing and the robust nature of that, I just don't see us being able to make any ground up anytime soon. And I'm sad to say that.
Great, thank you so much, Dwayne. So there's a couple of questions that have come into the chat that I think are going to be helpful for us to respond to. And one of them is, what is the biggest misinformation that we need to be aware of? And I actually played a game on Zoom the other day about sort of all of the misinformation that has. So I'll start. One is that there's a cure. My West Indian family has been sending me lots of lists of bullet point things that I should be drinking every day to make sure that I don't get coronavirus. So that's one. That if you have antibodies, it means that you cannot be reinfected or that you won't infect others. So that's another that I'm not quite sure about, but I know that I'm hearing. And then also that the mask wearing mandate is about managing civil liberties as opposed to managing community health. So what else have you heard, Dr. Harris, that we need to be aware of in terms of some of the big misinformation going around?
Well, let me say that one about the antibodies, because you've already made it clear, and hopefully there is no cure, right? And mask wearing is about public health. You know, people should think about it. I've seen a couple of things that I like. We go into a restaurant, I've seen these signs: no shoes, no shirt, no service, right? So we all have to wear our seatbelts. There's a reason. Hopefully in most states, so there might be a state or two, but you have to wear helmets when you ride a motorcycle. So this is about what we know works. And I think people think it's so basic and so common sense, although, as my grandmother used to say, not everyone has common sense, that it's not science-based, but it really is. Wearing a face covering does help you from receiving the virus and becoming infected, but it also limits the opportunity for you to spread it to others. You know, that is just a fact. I want to say something about the antibodies. So what are antibodies? Antibodies are what our body does. Our body makes antibodies when an invader comes into our body, some infectious invader, anything, our body says, uh-oh, this is a foreign person, a foreign thing, it doesn't belong here. And our body starts to do lots of things, but it makes antibodies. And again, this is a new virus. So we know, of course, our bodies are making antibodies when you become infected. But what we don't know right now is how long they last. And so that means that we don't know how long or if we will be immune. So that is a myth. We just don't have the information. So I just want everyone to know, even if you've had COVID-19, you had a positive test, still wear your mask, okay? That's just the best practice going forward. I think the other, 5G is a myth or something I keep hearing. I don't sort of really even understand that, but no, there's nothing. And some people are, and Dr. Fauci invented COVID-19. Those are just a couple that I've heard lately that are absolutely untrue.
Somebody out there on the social media verse, please go ahead and tweet that you still need to wear a mask if you haven't had antibodies and have had the virus before, please. I think that is the one that is the most concerning to me, because I'm like, people are gallivanting about people saying I've had it, I'm good. Yeah. And that, that's a concern. Go ahead, Dwayne.
I would add just age. This whole thing, if you're young, you can't get it. One, you mentioned earlier, there are two dangers here. It's not just you could have it, be asymptomatic. That's one issue. But two, what you're doing to someone else, whether it be a parent, a sibling, or a grandparent. I think this issue right now is evident. There really is no age you can be at this point that I'm aware of. I think even now, infants understand. I have some cases. There is no one that's immune because of age. And I have my kids are in their 20s, but I see them all the time. You got to wear a mask. You got to social distance. You've got to do all things we've talked about. I just think younger people are maybe getting the message. But I still can't believe why you're going to go to a beach party or why you're going to go into some sheltered place. These things, again, I guess I'm trying to tell young people, please be safe, but you're not immune to any of this.
Right. And it's a hard pill. I think all of us are managing the shift in our normal having to do with managing this virus. I'm coming from home. Looks like some of you are, right? And so we have to manage the what we want to do versus what we need to do, because the more that we resist and not do those things, the longer we will be in our homes.
Well, absolutely.
And there's a question that came through on the chat that is, what do you say to employees who are or employers, I guess, who are forcing people back to the office with an uptick in infections? Yeah. Dr. Harris, or do you want to respond to that?
Well, certainly, I don't think I can say anything that would be a blanket rule about the need to come back to work. It's very dependent on the nature of your work. I will say that one of the things that we encourage at the AMA is, and just it was our expectation about physicians, of course, and nurses and all the other folks that work in the hospital who didn't even think twice about going in. But for a moment there was not adequate PPE, and we were clear that we were happy to go in and do the work because that was our profession, our calling. But we did have an expectation that there would be adequate supplies to keep us as safe as possible. I think we all know, just in most situations, there's no such thing as 100% safe. There's no such thing as zero risk. And so I can't make any blanket statements, but what I'm hoping is that everyone who has employees, they should work to do whatever they can do to keep those employees safe, providing PPE, looking at sanitation policies and procedures. I think that is what we all need to do. If we work together to make sure that we make all environments as safe as possible. And of course, those are environments that are essential, that can't shut down. So that all of us, can, trash, picking up the trash. And there are some things that, can't shut down. There are some things that can shut down, right? Bars, indoor bars, and things like that. So I think we have to look and make sure that the businesses that are moving forward are the businesses that really we need. I mean, I love a nice meal. I love a mani and pedi. But certainly I hope that what we are doing is making decisions about making sure that businesses, physicians' offices, we want folks to come in and get their health care. And those are the type of businesses that should be prioritized. But I encourage anyone on an individual basis to work with their doctor and their employer to determine their own risk factor and their safety, what's best for their safety.
Go ahead, Dwayne.
So we're at Nobar headquarters. We are actually still in a teleworking mode. I see us probably staying in that policy position right now for the foreseeable future. We've also, as an organization, we still have mandatories on official travel, in-person chapter meetings, regional meetings. So we are pretty much trying our best at the Harris and Paula to really try and follow those guidelines. But I agree, we have the luxury of being able to telework and shelter in. But you're right, there's a vast majority of critical professions and occupations that don't have that luxury. And I do agree with you that the combination of your employer, your doctor, et cetera, and let's be very frank about it, even with our schools now, are we going to provide PPE for our teachers, for example? And how are we going to also keep our young people, our kids safe? So they're very complex issues, but yes, we as a national organization, international organization, are still following these sheltering in guidelines.
One of the things that I can just add in terms of looking at this from the legal perspective is, as I said, I'm a lawyer, and I'm a part of a lot of different groups, including the National Bar Association, which is talking about some of the policies that need to be implemented and have consistent policies that, that align with what you're saying, Dr. Harris. Yep. Not too many people in the elevator at one time, yep. Having place marks on the ground that show where people should stand in order to help people not have to guess what 6 feet is and actually know what it is, and then providing guidance to employers about how to manage people who are employees who have underlying issues that will prevent them, even if they need or requested to be back in the office, to align with having to manage that. These are all very complicated and challenging things. And I'll just say, I'm a parent to 2 children who are in school, and I have said what has been at least put in place here in New York City is not good enough in order for me to say I'm going to be able to send my children back to school, right? And so they're individual things, but I think policy-wise, we look to our leadership to be able to set these policies so that we can feel safe in terms of how we're going to make the decisions on interacting. And it has just been clear that some of the issues that are being made, city, state, and federal-wise, have not had the public be, feel safe about that. And so we have one more minute, and I'll just go ahead and ask both of you as panelists if you'd like to share any parting words with our audience prior to us closing. And I'll go ahead and start with Dr. Harris.
Well, I would just say a couple of things. One is make sure that we follow the advice that we used to hear when we were on a plane, and it's put your own mask on first before helping others. So I encourage everyone to make sure that they are doing what they can, trying to eat fresh fruits and vegetables, try to get some activity, try to sleep as best you can, and ask for help when you need it. And the other thing is wear your mask, stay 6 feet apart, and wash your hands. And again, thank you for the opportunity.
Certainly. And before, Dwayne, you give your comments, I'll just let the folks who are watching know that we have 3 more minutes to accommodate any additional questions. I spoke too soon. So I'll see if there's any there before I ask you to close. Okay, go ahead, Dwayne.
Yeah, I agree with everything Dr. Harris has said. We've all discussed already during this panel discussion. But I would also just say, and this is a apolitical statement, but when our grandparents used to say that your life depended on voting, that your life depended on it, sadly, we actually are now living in those times right now. And I always encourage everyone that we've got to somehow lend our voice, whether it be state, local, federal, national. We're going to need to go to the polls in a safe, practical way and vote. We as people of color, Black and brown persons in particular, but the entire nation is really been, and again, I said, disproportionately impacted as a nation. Well, 4% of the world population, approximately 25% of all the worldwide cases. Vote.
You said that with your chest.
Yeah. No, we're apolitical. We're apolitical. We don't endorse anyone.
We're a nonpartisan organization.
Yes.
Encouraging you to exercise your citizens' vote as robustly as possible, whether it takes you to do that via a vote that comes from, mailing in or showing up in those lines with your mask on and 6 feet apart. It is imperative that we utilize our civic duty, which is to vote, not just because of all of our ancestors who fought for it, but also because of right now and the people who are coming after us, who are relying on us exercising that vote, because clearly some of the decisions that are being made need to be shaped by our decisions, which is in those roles. So right now, while we have 1 or 2 more minutes, there are not any questions in the queue. So I want to just talk. Okay, let me just check. As soon as I said that, something else came in. There's a bunch of thank yous. So we want to thank all of our attendees for your engagement. And again, I want to thank the panelists for your feedback, your opinions, and your expertise, and say to everybody, and I say in every single chat, which is, don't leave this where it is. Make sure you connect with panelists, via, social media, on LinkedIn, wherever is appropriate, and connect with each other, because we need to make sure that we are staying as a community and supporting each other through these challenging times. All of you, be well, wash your hands, wear your masks, and meditate.
Yes.
Okay.
Yes. Stay safe.
Thank you, everyone.
Stay safe. Wear your masks.
Yeah.
Yep.
Bye-bye.